Good morning, everyone, and welcome to USAID Jordan Competitiveness Program e-health session within the ICT Forum. Welcome, and thank you for coming. Today, our e-health session will be focused on solutions and technologies within the healthcare systems, the benefits of these technologies to providers, to hospitals, efficiency of the systems, and cost reduction. I think if we talk about technologies in healthcare, we know that the most beneficiary of technology advances is the healthcare system. And new technologies in medical research have led to many disease and ailment discoveries. And many of the drugs and medications that we discover today are a result of the technology advances that we have done. New emerging technologies in bioinformatics, computational modeling for protein discoveries would not have been happening if it wasn't for technology advances in health. But the health solutions are beyond, or the e-health solutions are just beyond discoveries and research and treatment. It goes to patient care. And for healthcare providers, we know that for practitioners in healthcare, there are better tracking and monitoring of patients, better flexibility, and personal communication between doctors and patients. There's also, a wealth of data collection that can be beneficial, benefits hospitals in providing solutions for their operation, for their patients and how they treat them, what targeted treatment they can tailor to their patients, so what we call evidence-based medicine. Today, our guests will talk concretely about their experience within the e-health arena. Our guest, Ihab Haddad, is with GE Health Solutions. He is the project manager for the Saudi Ministry of Health and responsible for the e-health interoperability standard project. And he will talk to us today about the solutions that are being implemented in Saudi Arabia. Mr. Henrik Alberstein is the CEO of UNMED. It's a hospital in a box, or what we call cloud-based solutions to help hospitals manage their operations. And he is focused on emerging markets, Kenya in particular. And Mr. Amir Barsoum, he's the CEO of Dr. Bridge. Dr. Bridge is a cloud-based solution for general practitioner clinics that manages patients from referral to inflow of patients. And we will be starting our session to actually talk about their e-health solutions in the context of the MENA region. So I'm going to start with the first question, and I will hand it to Ihab. As you work with the Ministry of Health in Saudi Arabia, we would like to know the cost and revenue benefits of new technologies for hospitals on the revenue cycle, on their general revenues.
Good morning, everybody. Thank you so much for the introduction. Again, my name is Ihab Haddadin. I work for GE Healthcare in Saudi. Obviously, I'm trying to share with you some of my knowledge and experience that I have gained for the past almost 3 years working on this crucial project in Saudi. Obviously, I'm not going to be speaking on behalf of the government of Saudi, the MOH, nor I'm going to be speaking on behalf or promoting any of the projects that GE sells, because we are here also for a very specific target, for a very specific forum. And we thank so much the JCP for their excellent work on this, USAID as well. I think this is a very strategic event for Jordan and for the e-health or for the health services in Jordan. Now, I wanted to share some of my knowledge with you. I don't want to speak that long. And I realize that we started a little bit late on the session, so hopefully we still can actually finish it on time. But in order to gain perspective and share my experience with you and see if you can share your experience as well with us, we need to scope the e-health. What do we mean by e-health? And how it is being looked at by the healthcare providers, by the patients, and by the different levels at any country, whether at the national level, at the regional level, or at probably the hospital level. When we talk about e-health, it's actually providing health services enabled by technology. That's the essential part of it. And to try to answer the question about the cost, we need to realize what are the benefits of having such an infrastructure that would allow us, without the patients, without the doctors, the nurses, the practitioners, have a better type of relationship, a relationship that would actually result in a better experience for the patients and also a better care system that is being provided by the hospitals. I think when we talk about technologies, there are different types of technologies in a hospital, in healthcare providing services. We talk about technologies in terms of products, like machines, MRI, ultrasounds, and so on and so forth. We also talk about technologies that help the operations of the hospital, the workflow in the hospitals, how patients go through their visit in the hospital, what are the bottlenecks, say, in the hospital. And we also talk about technologies that allow the hospital to run its operations as a business. And when we talk about business, obviously we talk about cost and return on investment. I think, and there's also the infrastructure part of the technology. And so all of these can be looked at as part of the enablers to having a better provision of healthcare systems or healthcare services to the patients. Now, if the focus is actually the patient, and I like what the Saudi Minister of Health has adopted as their strategy, as their vision, is that patient comes first. And whatever they do, they have to put in mind how this is related to enabling the patient to have a better experience in the hospital, having a less intrusive types of products and services that allow the diagnostics, but in a more convenient way, more way that allow them to have a better experience. So the e-health part of it, and that I wanted to try to scope it as much as I could, so very limited minutes. We are actually concerned with how to improve the patient safety, the patient's quality of service, the accessibility of patients to the hospitals, and also the revenue cycle. When we think about the revenue cycle for the hospitals and how they should actually look at their return on investment, they should think about how the patient feels when they come to their hospitals, what are the kind of operations that are being given to the patients, and what are the technical advantages of having certain products and services in the hospital. And therefore, the cost should always remain focused on, yes, the technologies and the cost of investment in the technologies, but the return on investment is actually the patient and how the patient is being treated, the safety, and so on and so forth. I think the main point that I would like to discuss probably throughout this discussion is that the rate of return on the investment for the hospitals are much faster in this business than in any other business. When you look at, for instance, airline reservations, when you look at your business, doing business with your banking system, it's enabled by technology. So the amount of investment that those businesses put, and the return of investment is partly because of the customers and the expectations of the customers that they need to find some sort of technologies that allow them to do banking with or to conduct their businesses with their bank, to reserve their flight tickets and so on and so forth. So the same expectations is true also for the hospitals. However, based on my experience, I think the rate of return and the time element on the return of investment for the hospital is much better, it's more faster for hospitals than any other businesses.
I think, so we can see the return of investment is an important aspect to highlight, especially for hospitals. But often hospitals or healthcare providers look at technology as a burden. What is the cost associated with it, especially in emerging markets, and how what it takes to train staff to implement a new system, infrastructure, and then maintenance of this infrastructure, or the risk of what if I have a glitch in the IT system and the doctors cannot access patient records? So what happens? And I'm going to direct this question to Mr. Hendrik, and because you focused on emerging markets with your with UNMED, a cloud-based health solutions for hospitals. Can you tell us how do you adapt that in a not so advanced or developed infrastructure for IT solutions, and how do you get doctors and hospitals to actually adapt the technology?
Thanks, Maggie. So I'm Mr. Henrik. So in Europe and USA, you have had healthcare systems for many, many years, and so the question, if I was a Jordanian hospital, would be, when will technology allow me to have an equal system, but at a price that I can actually pay and make sense for the level of revenue I have in my hospital? So I would argue from this year going forward, the modern technology stack would allow that. And I will bore you now with maybe 1 minute of anecdotes about trends that has been going on for the last 5-10 years that makes now an interesting point in time. So 16th of March 2010 is a date everybody doesn't really aware of, but it was the date when Microsoft announced that they would support HTML5. And what that meant was that the world now agreed you could use the browser as an interface to an application. So that was a big date for humankind. So what has happened since then, that whole infrastructure, and that's a lot, has then matured to that today you can actually make an interface in a browser that you can't see is not installed native on a computer. That obviously has a big cost implication. If you have like 40 working stations at a hospital and you have that as PCs, you need antivirus, you have power backup because it consumes a lot of power. You have a lot of maintenance, you have a lot of costs. Today you can have a Chromebook with a browser for $200 that looks like a MacBook Air that would run equally the same application. And you don't need to install any software, you don't need to maintain any software on all updates and so on. So that 16th of March 2010 was an important decision for humankind, and today we can do some really, really nice applications. That made a lot of other stuff going on as well. Google then made the decision, wow, now that we can use the browser as a big interface, JavaScript, which is a programming language, we need a professional version. So they made a super updated version called V8 and made it open source and put it out for everybody's access. So you suddenly could use that same technology on the server side and build. So that has a big implication as well for the whole development cycles. So on the software infrastructure side, other stuff happened as well. The old licensed databases, operating systems, so on, now are available in open source versions for no, of course, license fees, which means you can have a professional database, professional operating system, and don't pay any license fees. It's important for me because I need to target a price point that you find attractive, so I don't want to pay any license fees back in my system. And these are technologies now that are used by Amazon, PayPal, the big websites in USA, so it's really proven technology. And that's for free, those infrastructure components. So that has happened as well. And that matureness is also, it's this year, the big successful installations has happened in USA on those new infrastructure components. So that's also a proof that this year is actually a good year. On the hardware side, you will have a modern, if I should mention a modern server for a good-sized hospital, you could say 8 CPUs, 64,000 megabyte of memory, and so on. That's a Samsung S4 telephone I just described here. I can run a medium-sized hospital on Samsung S4 as a server. That's where we are today. So that's an important fact. We couldn't do that 10 years ago, I can assure you. So that's also a really good technology point. So software vendors today are able of doing a commercially proved, very low-priced infrastructure stack and provide that to hospitals. So those were some super important trends. Then I think what is good now, if you really don't have a lot of stuff in the hospitals, see a lot of the European countries, they bought a lot of stuff the last 10 years, and it's massive work to replace that. So they kind of stocked on a lot of old things, you know. So if you are to deploy now for the first time, or you don't have a lot to replace, then it's actually quite nice. We have a lot of experience now. If we divide a hospital information system that you should deploy, it should be one system, meaning EMR, ERP in one system. Because of reporting, you need both components in the same system. I was getting at where?
So the technologies over there.
Yeah, the technologies.
So can we say that today adapting technology into hospitals is of a lower cost than it was 10 years ago? And with a cloud-based solution, then there is, the possibilities and
exactly.
ease of implementation is much
exactly.
faster.
So the main point was, so you can now, one thing is, what does it cost for me to buy the system, but the maintenance is the real thing. Do you want a lot of IT people, or can you actually have a lower level of staff supporting the system? So that's a key thing. How easy is it to install the system? How low is the maintenance? Those are key things you should look at when buying a system. So those are experience. So now I remember where I came back from. So it's actually super important. So let me just mention it. It's this whole dealing with ICD-10, the EMR thing. We came from EMR. I find it extremely important that doctors are forced to diagnose using ICD-10. And that's not, they are not going to be happy about that. And they're going to say to me, but then I want a system that I actually want to use. And that's a fair reply to that demand. And that's not super easy. Doctors work really under stressful circumstances. And for them to tap in on a computer and find the right ICD-10 code, and normally they just kind of make some abbreviations, and then the whole journal is sent to a reporting department that needs to decode that doctor's stuff and type it in an Excel spreadsheet, and what do you have? So I think you have to require from new systems that the doctor approve that they're going to use the system. We allow doctors' own abbreviations for ICD-10 codes actually as a front layer on because if you don't get the ICD-10 code, then in 3 to 5 years, well, the funny stuff is going to happen. Right now, we're not talking about disruptive technology. We don't talk about e-health. We talk about how do you run a hospital as a normal company. There's nothing outside that we're talking about now. But in 3 to 5 years, something else will happen. And that's when we're going to have the disruptive talk about all the new sensors and devices and blah, blah, blah. And you will have to have your infrastructure in place when that happens. So respect for the users, having to sign off. I think now I'm going to cut off what I'm going to say.
So in a large hospital operation, hospitals must adapt the system and force doctors to use it. But now how about smaller clinics? How do you allow, have doctors actually adapt, the technology and be open to, integrating these solutions and the benefits for the clinic? So I'm going to give you that question, Amir, and tell us about Dr. Bridge's experience in Egypt.
Actually, thank you very much for this session. Thanks, Maggie, for this question. I was just trying to jump in and answer this as well for the private clinics. Actually, a very interesting thing happened when we in the very beginning when we started. We actually built a product, an EMR, to the private clinics, typical to what you would find in the US and in Europe. We showed it to the doctors, they were just amazed. This is fascinating, get it in tomorrow. And the research was like, more than 93 to 94% of the doctors, they showed positive response towards adapting and buying this. We built it. I remember that Microsoft gave us one of the best EMRs in MENA. We launched it to the market, and that's the bank. Everybody buys, nobody uses. So the doctor they buy, they pay you, but they just don't use. When they look at the system, when we go back to them, why you're not using it, it's just too difficult. The paper is much easier, and it's, you know what, we believe that we must have this, which is a good starting point, but the product in itself, if we sell to them the product that comes from the developed world, where basically their doctors are actually forced, like what Mr. Hennick was just saying, they were forced to use EMRs. It's not a choice. It's not like, you decide to be the cool doctor and you start implementing EMRs in your clinic. You're actually forced. And now, and even they went in the US to even more far-fetched thing. They basically pay the doctor money just for adopting the EMRs. And this, I'm sure this is going to happen in our markets like in 200 to 300 years. So let's be realistic. What can we do to ask doctors happily adopt this technology? What we did is actually we stepped back and we thought, what's the major problem of the doctors? And we realized there are three major problems. Before I just say them, I will give you some striking things. In our markets, you book a cinema in 2 minutes, you book a doctor in 2 days. Because you need to find the doctor, you ask for your friends about the doctor, you call the doctor, nobody picks up the phone, most probably this is a wrong number, you just stay for this for like 1 day, 2 days, unless you really know the doctor or you know the assistant. So that's one striking figure. In Egypt, this is, I would say, a real pain in this market. Another striking figure is you have all our, for example, banking history. You can just find it a click of a button on your applications. So if you just go and click on a button on your HSBC account, you're going to see every transaction, what happened, blah, blah, blah. But for medical records, forget it. You need to move with the piles of paper like this, move around from one doctor to another. If you go from an orthopedic to diabetes, just move around with these things. And you have no chance to move this to electronic way, which is another very weird thing. Third one is when you go to a lawyer, there is a very high probability that they're going to use a computer. When you go to an accountant, there's a very high probability that you'll be using a computer. When you go to a doctor, there is a very high probability that he doesn't know that computer should be used. So it's very simple because the product in itself was not, there's no product that suits their needs. So with these striking figures, we realize patients come as a very important thing, even to the very well-known doctors, to the strong ones, as they care for patients. And what we did is we catered the system to care for patients. We introduced things like patient engagement platform, care plans, so EMRs, but they are EMR from the back front. The doctor sees it as patient engagement platform. We also introduced the booking platform to solve these things. What happened is, surprisingly, the acquisition rate was slower. So the excitement of the doctors gets slower, but the usage gets much, much higher, which at the end of the day is what we need to do. And it ended up that doctors in the private practices are actually picking it very well.
So there are solutions that can be tailored to our region or the context of a country. But how, from your perspective, organization, as you see trends and solutions globally, how do you take those and adapt them to the MENA region? And then how, and again, to be more technical, how do you tailor it to the MENA region or emerging countries? And that's a question for all our panelists. But before we take the answers, if you use acronyms, I would encourage you to spell it out because not all our audiences have a medical background. So.
Okay, just an answer on this. I will take you through the process. So the process is basically forget about what's there in the developed world because that has nothing to do with our markets. And what we need to do is you get those who are going to use the product, those who are going to use it. So for example, the scheduler in the clinics will not be used by the doctors, it's used by their assistants. So we call the assistants, we put them in our rooms, and we build the product as per their needs. And that's the same what you do for the doctors. For example, with the ICD-10 discussion, one of the things that we did is doctors write hypertension HTN, and that's it. And there are like hundreds of hypertensions on the ICD-10. What we did is we start to do the mapping, so they in the front line, they do whatever they want. And we take this, clean it in the backward, and we do the mapping. So we build the whole system, the whole product as per what they do. I think it's enough of a disruption to move from the paper to a computer-based system. That's enough for disruption. You don't really need to go even in disrupting the content itself. So I would take it in step basis. That's what we do, and that was a pretty successful point.
Are the doctors implementing it?
Yeah, big time.
And they started liking it?
Yeah, big time. Big time.
In Egypt? Or?
In Egypt.
Okay.
Now it's in Egypt.
Yeah, I think the question, this is a very good question, is are they implementing it? I think it all depends, it goes back to what's the vision of a hospital, what's the mission statement of the hospital. And from there you can actually start thinking about what are the, as Dr. Maggie was talking about, what are the trends in the market, what are technologies that are available in the market, and how we can actually tailor it to our needs. I think like from a GE healthcare perspective, GE spends billions and billions of dollars annually on research and development, and there are different products and so on and so forth. I'm not going to talk about it, but the reason I just mentioned it is that there are smart technologies. There are technologies that are actually available. But then the decision-making process in a hospital or at a national level has to be in a way that is conducive to providing better healthcare for the citizens of the country. And if you talk about the hospital needs to become aware of who are the target customers, the patients in the region, in the city, for instance, or what we talked about yesterday about the medical tourism in here, patients coming outside. So you need to know your patients, you need to know their needs, and you need to know how to manage their needs and how to meet their expectations. The essential part of working in the business of healthcare is that the patient needs to have answers immediately for certain medical issues. When the patients come or shows up at your hospital, obviously their needs are sometimes very critical and very crucial, and the well-being of that patient is at stake. So you need to know what's the business model for your hospital, how you are going to tailor your services, healthcare services to your hospital, to your patients, and at the same time there are also other requirements. You need to probably be focused on what the government of Jordan here is talking about when they are talking about initiative in the e-health, and Hakim, for instance, was one example. We talked about it yesterday. So people need to, or hospitals sometimes need to be aware of what are the policies, and sometimes probably it's going to be mandated that they work in certain ways, in certain manners. So what I'm trying to say is that adapting technologies are there, and you need to find the people who are willing to study the requirements, to see what the business model they're going to adopt, and also what the needs of the patients, and then try to come up with a solution, and not just a piecemeal type of work with a vendor or with a supplier. You need to have a comprehensive solution for your hospital, so that you manage your hospital, the operations of the hospital, you manage the workflow in the hospital, you manage the assets of your hospital, and so on and so forth.
I think for individual hospitals to adapt technologies or ICT solution, whether to manage their operation and to manage patients and to access information much faster, to provide better services is a crucial thing. But to take it to the second level or next step is how do we, when a hospital adapt such technology, to have a network of hospitals connected. So a hospital can send, in the U.S., a hospital can send an image to another hospital. They can acquire a record from another hospital. You can send prescription to the pharmacy. So how do we, in emerging markets, put value on, connectivity between hospitals and exchanging data, so providers can, see the value in that, whether from ROI or, from the technology perspective.
I think this is a very interesting question. It's a very complex question at the same time. The ecosystem of healthcare provision is so complex. There are different vendors, suppliers, doctors, practitioners, nurses. You're also talking about pharmaceuticals and so on and so forth. And I think the essence of it is that we need to keep the patients first. The core of our business is patients. So you should expect that you're, in order to become a competitive business in a market with lots of hospitals, you need to have your edge. You need to understand how your business model fits, and also understand the needs of the patient. In other words, if I'm a patient today, I'm in Amman and I work in Riyadh, what happens if I get sick in here? Should the doctor be concerned about my health record in Saudi? I've been living there for almost 3 years. So these are the questions that they need to address. I think it's imperative that we connect our healthcare providers in the country and probably across the region and globally. And the reason is that, one of the reasons obviously is that I know that hospitals in Saudi are trying to get connected with hospitals in the states such as Mayo Clinic, because it's in their advantage to get that connection. And therefore, everything has to be set in a structured way, in a way that actually can help you get your patients' diagnostic, clinical images, so on and so forth, to be sent to those clinical advisors across the globe, across the continent. So you need to have a structured way of doing things. The solution is not easy, but it's logical. If the people in a hospital or the decision makers in a hospital or at a national level have the will to do it, it can be done. It's a complex system, but the advantage has always to be targeted towards how we can actually better serve our customers, which are patients, and sometimes their lives are on the line for it.
Yeah, so there's a lot of cultural thing also going into this, but my first advice would be not to be too ambitious. First, understand your business and understand the numbers. We have a basic rule, just to correct you, Maggie, so we don't do a cloud-based solution. The reason is that we think emotionally the patient belongs to the hospital, so that's where the basic data will always be in the future for us. The sharing of patient information is important, but some questions you need to find out. What do we want at this hospital in this country would be the doctor's notes. Who can see that? Can the lab see the doctor's notes? Which part of the doctor's notes can the patient see? Other hospitals, it's easy now to make a safe solution where you can have an external lab logging into your system, get an SMS with a code that will work for one login session, tap in the data on the patient journal, blah, blah, blah. What should they be able to see? So you need, before you open all that, you need to feel comfortable about what do we actually decide here, what is our policy and what are the regulations. So I think don't be too ambitious on sharing. Get the stuff up and work, what works for our hospital, what is legal in this country, and then you can start answer all the other stuff afterwards.
I have just one fast comment on this. When we look at our healthcare ecosystem, some of the entities are actually much more advanced than others. So if you look, for example, at the lab chains, they're usually much more advanced and much more automated in using technology in their practices. So I believe personally, and we in Dr. Bridge and in several markets, actually, you start by the data with these people. That will create the nucleus or the seed of data at the hospitals or at the doctor site, which will in itself encourage them to build up over it, rather than you just start from scratch. Having some lab data or scan centers data is a good seed to start from, and that would encourage the rest to go on.
Well, does Dr. Bridge offer referrals from general practitioners to hospitals or to specialists? Is that, technology available?
Yeah, it does. Actually, we go and work with general practitioners as well as specialists. So because in Egypt, both of them are in the outpatient side, they're not in hospitals. So we work with them, with the general practitioners, the specialists, and we provide referrals, doctor to doctor, doctor to lab, and doctor to scan. So yeah.
Good. So one question is, what is the vision for the MENA region? Where do you see ICT solution heading? What are, so today it's adaptation of application to, either individual clinics or hospitals. How do we see it in the next 5 or 10 years? Do we see big data? Do we see sharing and network of health systems connected with one another? How do you see that?
So just short on that, I mean, we have a big vision that all hospitals installing our software will allow anonymous data to be consolidated on a country level for government to access. So you will have a real-time health monitoring of the whole country, which we find pretty hot actually. So that we expect to happen pretty soon actually.
Yeah. So I think, to answer the question, I think we need to make some assertions or assumptions. One of the assertions that I could make is that the technologies are there. The products that are enabled with technologies are there. We know that they are like PAC system. Most of us know the picture archiving systems that we have in radiology and things like that. So the systems are there. Technologies are there. What is the trend is actually based on how we think we are going to not just survive today as a business, as healthcare providers, but what's the vision for us in 5 years, in 10 years. The growth in the population, the access, the capacity of hospitals, how we can improve on workflows, how we can accept more patients, how we can deal with e-referrals, for instance. Yes, there are systems that actually help you with e-referrals. Hospitals are treated as exchanges, and you look for what is available at a specific point in time, and you can decide whether you should take this patient from your hospital to another, either based on the critical aspect of this patient, or if it's near or far from you, the distance. So there are exchanges that we have implemented in so many different regions in the world that actually help you with the referral, which is called e-referral. The bottom line is that there are standards that we need to look for. I know I have been working with international standards that actually give you some domains that you can actually dissect your enterprise businesses. You can take, you can look at domains such as, for instance, prescriptions, drug prescriptions. You can work on patient discharge summaries. You can work on immunizations, e-referrals. You can work on identification of the patient, which is also important. Because if you are trying to identify uniquely a patient and their needs, you have to also identify it in the system uniquely as well. And there are teleradiology domains. And with those domains come the standards, international standards. And why I insist on the international standards is because when you are implementing those types of e-technologies that you want to have in your system, you need to make sure that you are also connected internally within a region or probably at a national level and also at an international level. I know that for a fact in the Gulf states, in GCC, they wanted to look at Saudi as the first country to adopt e-health and see how they can actually govern the GCC healthcare provisions as well. So Saudi has become the model for them. And therefore, you cannot have a Saudi standard. You cannot have a Jordanian standard. It has to be an international standard, especially if you want to think about the future and how you want to connect your healthcare provision, not just in the country in here, but across different countries in the region and probably globally as well.
Just answering the vision question, I think in the coming 5 years, we always have the public sector and the private sector. And I would see in the countries where they are having a strong investment and spending on healthcare, the public sector will be leading. You could put Saudi Arabia, UAE on the top of these countries. And for the other countries where the private sector is actually the leading, you will find the vice versa situation, and definitely countries like Egypt, where basically the government doesn't have enough spending, and so on. And then other countries are in the middle, like Jordan, like Lebanon, and so on. And so I would see that there will be a very strong usage at the public sector for those countries who are spending well, and at the private sector who they have large populations, and so on. And from the post this, I believe in post 5 years, they will start talking to each other, the public and the private. I'm not anticipating this to happen in the coming 3 to 5 years. This would be too ambitious, but I think they will start communicating together post 5 years, maybe 5 to 7 years, something like this. So that's how I see how ICT could take a significant role in our markets.
Good. I think as we see that e-health solutions for healthcare providers, for hospitals has a huge value, we want to emphasize the return on investment, the ROI in adapting these solutions, but also the benefits for the patients from better access to information and faster access to information. And as whether private sectors or the public sectors adapt or lead the initiative in e-health, in emerging markets, at some point, the vision is for them to come together. Just as we walk and then we meet somewhere and come together, and that's what I think, or I would conclude that the e-health for the MENA region would really take off. I appreciate your time and thank you. We're going to take 15 minutes for Q&A, and then after that we will have a meet and greet session where our guests will get a chance to interact with our attendees.
Thank you. Rahim Abdali, Dean of Pharmacy at Yarmouk University. My question is regarding the data for research. We are suffering in the area from lacking real data in our regions. And what's your idea about this? How can we use these systems
Yeah, this is a very practical question, and it's rightly that we address it in this forum. I think we talked about sometimes the doctors require some sort of technologies in their offices, but they don't use it, or if they use it, they might not use it in the proper way. And so, if you want to get to that level of data sharing, data mining, and what we talked about yesterday as a type of preventive medicine, you have to look for, or probably research, as you said. You need to look for data that is credible, that is updated, that is a continuous feed on the health of each individual that comes to the hospital. It's not an intermittent process, it's a continuous process, because sometimes even the patients would not like to have a continuous type of health record for them, so that as they are progressing in age and in health, they need to be aware what are the things to expect in the future, and what are the expected illnesses based on their environment, type of work, how they do work, and how they live their life. And so the research is important, and in all this, the market for e-health is also should be a market directed for research and development. And I think sometimes you can have the best technologies, but if it's not used in the proper way, then this is a part of the problem. I think part of the problem is to having skilled people who are doing the job, the right job in the hospital. So in other words, the technology is there. The leadership in each hospital has to make a decision how to manage their operations. And at the end of the day, what you get in terms of data is what you can use. Maybe we are talking about public policy that should be mandated by the government. that we are interested in doing more research and to predict what's going to be the future needs of our population and how we should meet those needs. So yeah, I think the technology can help us, but we need to use it in a better way. And what you said is actually part of the discussion on what is the cost and what's the return on investment. If you put the research as part of your components, part of your variables that you are trying to measure, then it becomes more cost effective to have proper machines, proper diagnostics, and proper technologies that can help you produce the results that you need to collect and then to do data mining on later. I think we talked about it yesterday as Hakeem. I think you have about 700,000 records on patients in Jordan, so it's a huge data. I think MOH is responsible for the data. I think we need to tap into it, but we have to go to have the governing body that actually regulates this type of transactions and how we analyze data and how we can actually serve the research and development in Jordan.
Hello, good morning. I'm Mu'tasim Jokdar from Infograph. Just a comment, it's not a question. We believe from our experience a very important part of the technology that we can implement it in the healthcare sector in general is the Geographic Information System, the GIS, and how it's the effective of the map and how it's effect of the awareness and the common operation picture of the healthcare sector in general in Jordan, for example, or any country, and also how we can see how can we analyze the distribution of the position and of the clinics and health center, and how we can increase the services of these health centers and hospitals. Hope it will be implemented or adopted by your programs in the future or near.
I think this is a good question, and this is a question that should be answered whether in Jordan or Saudi. I think in Saudi, based on my experience, it's a huge country in terms of the area, and there are certain areas in Saudi that's not well served in terms of healthcare services. So locating those areas, I think what you're saying, geographically locating those areas, and actually connecting them to healthcare centers that have specialized services is important, because you can't bring ultrasound in a region where you have thousands of people, few thousands of people. You need to connect them. So the connectivity is there. The geographical locations are very important. I think part of this e-health would enable us to do that. One of the projects that we are working on is how to connect radiology, for instance, reports and orders across Saudi. This is an important. There is a profiles. Some international standards have profiles, have codes. Diagrams, for instance, one of the codes that allow you to use specific codes to transmit information about specific reports for teleradiology, for instance. And so this is an important part. E-refer also, the one that I mentioned, is that how far your patient away from the better caregiver and so on and so forth. So yeah.
Just a short remark also. So in the old days, you had a timestamp on everything that happened in the computer. You generate a transaction, you put a timestamp. This is when it happened. Today, you put in a location as well. This is when it happened, and where did it happen? So everything going on in the patient journal, you will know, oh, this was that laboratory was placed there, the patient said you were sick there, blah, blah, blah. So that's one side of it. The other thing is we didn't talk about it before, but that's this, what about video conferencing, audio, video, messaging and stuff like that. So the world has decided on the standard for doing that. That's built in your browser today for doing like Skype-like video conferencing and so on. So you should expect that from your hospital information systems as well. Internal systems for video, externally and so as well. And we talked about location. The browser will also give you, after asking your permission, the exact location of where you are. So that's good new stuff from technology.
And it actually, just going to this point, it will help a lot in different investments. So, For example, if a pharmacy wants to open a branch in the US, they actually understand what's the population within this area, and actually at some places they don't give them a license unless the population is above X 100,000. So this is the same in our markets. It's the distribution usually is found in the cities where you can find very high distribution of doctors and pharmacists and providers per capita. And then when you go to other cities, despite it's much better financially and the return on investment to the providers, they just don't know. They don't know where should I open my pharmacy or I open my clinic that could get me much better return than I do and open it in the center of the city. So yeah, that's
Ahmed Tijani from Not Health. A question and a comment. The question is on compulsory regulation implementation on e-health. From your experiences, did it work or it did not? That's the question. The comment is regarding the exchange of information and the exchange platform between the areas. I think in the States they tried something called medical trading areas, where they have the counties reporting to a hub and then connecting the hubs with each other in a centralized area where everybody can access the databases according to strict security and confidentiality agreements. That is the comment. But I would like to hear, because the regulatory part of this whole thing is very important to speed up the process of the implementation of e-health.
Yeah, this is a good question. Let me tell you something from a practical experience based on the project that I have been working on with Saudi Ministry of Health. When the Ministry of Health started or made the decision that they are going to do the e-health program, they didn't have the policies actually to govern it. And so what they did is actually, while working on different profiles, different standards, and so on and so forth, we were developing two types of policies actually. The first policy, which you mentioned, is that how you actually manage and develop and gather information about your patients, and how you store it, how you deal with it, how you can keep it confidential. When you can, the concept is when you can break the glass, when a patient's like in a serious situation, who is going to give, suppose the patient is unconscious, who's going to give the right to the doctor to actually break the glass, in other words, to access the information about that patient. So we dealt with it. We have not yet implemented it, so I cannot give you a practical sense of it. However, the way that we conducted our policy for the health information exchange was that we took what are the domains that the ministry wants to deal with, and we try to govern the policies around those domains. One of the domains is actually how to identify your patient, uniquely identify the patient, how you can access, who's responsible for managing the information. And they are trying to come up with a center of excellence whose sole job is to gather data, probably similar to what we have done here in Jordan, Hakeem, for instance, gather the information about the patients, connect all the healthcare providers to that exchange, to that database, and see how far they can get it. Now, most of the policies were based on some subject matter experts who came from outside the Saudi, but they were tailored to the needs of Saudi. There are special needs as a kingdom in Saudi with their culture, forms and norms. We had to take it into consideration. There was another type of policy which is as important, is how do you certify vendors and suppliers who are giving you their machines and products and services, and they tell you that is up to the standards, international standards. So you need to put the policies through which you can test and verify that those products are up to the standards, whether at a product level or at the service level. And so those policies were put as we were developing this project. We are going to also create a lab in Saudi that the sole purpose of it is certifying and verifying that those products, those services, up to the standards. I think the expectation of any policy has to be a policy that is mandated probably by the government in here in Jordan, and therefore, the private and the public sector need to become aware of this is an imminent. I think in my mind this is imminent. It's going to happen. I think the more the public and the private sector talk to each other, discuss these issues, the better the type of policies that we talk about. And obviously, it has to be tailored to the needs of the population here in Jordan, and take into consideration the cultural barriers, the cultural norms and forms in here, and you work on it. And with time, as you gain more experience, the policies should and be allowed to change to adapt to your needs as you go on.
Dr. Muntaha Raibe, Secretary General for Jordanian Nursing Council. I have a comment which was raised earlier about physicians' resistance to using e-health. And I think it was documented in the literature as well as in Jordan that one of the points is they're scared of legal and liability issues to document them. Through this process, the traditional process, they can probably get away with things, but with e-health, they're more scared of this. But my comment is, we know that investment in empowering the public and empowering people is not a recurrent investment at all. So I would like to see if you have anything that moving toward empowering the public through, in the future by looking at preventive measures, looking at empowering things. I will have, I was part of the MENA project on empowering women for the prevention against violence against women. So it was like a 2 years project, and the return investment for us is really seeing more and more happy women rather than money coming to our institution. So this is, I'd like you to see, to mention something about the humanistic aspects and care of people within this, money things that you're talking about. Thanks.
I think probably yesterday, if you had attended yesterday's discussion at 4, would have been the right, you would have gotten the right answer. But I'm trying to, see if I can remember something from last day's discussion. I think, yes, there has to be a human side behind our interaction with patients. Obviously, otherwise it's going to fail. It's going to fail at the first step, which is actually the interaction between you and the patient. What I can tell you is that, yes, there are legal aspects, but it can go both ways. A doctor can actually prove that he did the right thing electronically by having electronic records. So they can be fearful of it if they know that they have made a mistake, but they should be assured that if they put in a big question mark on their attitude, their conduct of business, then the electronic health record could help them actually. So yes, there is a human part of it. Yesterday we talked about the big data and the evidence-based medicine, how big data collected through our technologies and e-health and interconnectedness can actually improve on the welfare of our population based on the fact that when you collect data, when you analyze it, then you can predict the future. And then what you talked about, doctor, is you have a preventive, probably, plan. We hear nowadays about the Ebola virus in West Africa. Do we need to be concerned about it in here? No, because we are far away. But does the data tell you what are the maybe the viruses or maybe the epidemics that should be controlled in here? Do we know that? Do we have any preventions of doing that? Are we prepared? So the data can tell you how much we are prepared. What are the epidemics that we could face? Is it like how relevant, for instance, in Saudi has become a big success stories about breast cancer screening because they are detecting breast cancers early on. And so those are things that we can become more proactively seeking and looking for if we have the right infrastructure, and technology can definitely help in that area.
Yeah, also I think we use this concept of Maslow's pyramid of demands. I think right now, I don't know if that translates into some Jordanese thinking, but I think what we talk about now is the basic level. How do I run my hospital, and ensure all basic stuff is going on right? That will include in the first level also to have authenticated means of communicating with patients of SMS and email and on web in a secure way. But I think when all that is up and running, then you can concentrate on the aftercare aspects much more. So that's, the patients are the consumers, it's the customers of the hospital, so of course they're super important. And as you say, it's human beings, so that's even more important than that. But I think the registering of the ICD-10 stuff and so on, I see in some other countries where you have some cultural phenomena about rape and so on and so forth, that were not collected and consolidated. I think when you start gathering information, suddenly you become innovative and you get insight into what can we now do with that information. So that's why we have very strong opinions of ensuring that information is connected.
And actually, the availability of healthcare data, which happens through e-health initiatives, whether from the public or the private, actually it pushes down the cost of healthcare, which has its humanitarian effect. Like 3 years ago, directly before the revolution in Egypt, we were involved in. I was involved in the national health insurance system that we're trying to implement there. I can tell you the lack of healthcare data in the country was one of the huge barrier of moving forward, because you just don't know. You don't know how much will this cost us. You just don't know. We're jumping in a black box, nothing there. And it ended up that the whole project was being postponed and delayed because we don't have any data. So I think the availability of the data that happens through e-health helps push the whole healthcare system to a cost containment.
Hey, Shannon Clark, co-founder from MediReview, mobile health startup here. We're actually from the Latin America, Caribbean. And actually interesting points being raised here by both the panel and also the audience here. When we speak about aftercare, I think it's also important. How will we also contribute or even facilitate continuous care? So for instance, nurses and also for the elderly, how do we utilize some of the data that's being used inside the hospitals and provide that, educate those patients, whether it's at home with their families or even their current care team? How can they utilize that information and then feed it back to the doctor? So the doctor then would know what's going on in between visits. I'm wondering, is there something in the cards for that, similar to the Blue Button initiative that they've had within the States? There have been some successes, some failures. There's now Blue Button 2.0. And a new initiative regarding that, maybe GE would be able to inform us how to utilize that here within the region. And even within Latin America, one of the issues we've had within the Caribbean, where they're now implementing the health information systems, is that because they've taken the institutional approach, trying to say, okay, how can they reduce the healthcare budgets? There's been a long process, and then you've had certain delays, such as, for instance, the dissemination of information about chikungunya. Other diseases such as the fear of Ebola, where then people have a lot of misunderstanding. So how can we avoid that? How can we actually get this information out and maybe accelerate the pace of actual patient care?
I just have one comment here. I think that's what I was talking about when we mentioned the concept of patient engagement, where you start empowering the patients, and that was one of the things that worked very well in Egypt, which is basically providing a platform to communicate with the patients for more of a chronic disease education, preventive measures, and so on and so forth. The only problem I foresee in markets dominated by the public sector, that these kind of things, you can't really prove the ROI easily, and that's so for the private sector, the private-driven sector, they can see a lot of value in more of a medical marketing, if you want to call it, when they do this to their patients. But if you move to the public-dominated sector or even to the insurance-dominated places, it may be a bit difficult to prove the ROI. And I think definitely if it's proven, and definitely can give more sense on that, will definitely do a lot of value.
Yeah, so I think some of the good news are that some regions of the world are extremely advanced in aftercare. So I see that not even as a next wave. I mean, when the first infrastructure is in place and and your hospitals are well managed and you use the information in a good way, it's very, very easy to have, this diagnosis will then impact that the email gets sent this information about how do I deal with this disease, information to the family, and so on. And just in my small country where I come from, Denmark, with only 5 million people, it's very advanced. And you see that as humanity thing. It's just something you do, it doesn't cost anything, you send an email, but everything is automized. That alone can help a lot, the understanding. I don't know if there's anything you have.
I think, for the sake of time, I think I agree.
One more question.
Ahmed Al-Ghazawi, CEO of Train Pharma Clinical Research Organization. My question, do you see these advances in the technology implemented in clinical research? Like, for example, consenting patients over smartphones, downloading study protocols on smartphone, managing patients that live far away from research centers through high technology. I've seen this is a hot topic in the US, and it will be the future for the conduct of clinical research. And I would like to see your input. How do you see that in the region, and especially with centers in Saudi Arabia that are very active in research? Even we believe in Jordan, we were the leader in the conduct.
Yeah, I think we probably answered part of the question when we talked about how we can use data in research and development. I think in Saudi there has been so many initiatives of trying to tackle this issue, how we can mobilize the healthcare services across different regions using advanced technologies. I know that we have been working on screening breast cancer for women by using mobile clinics, and we did it, and so it is very successfully. We also have mobile types of diagnostics, X-rays and ultrasounds. Mobile ultrasounds that can be taken, and you can use it, in so many different regions, and you can actually get them connected through the cloud or whatever means and infrastructure that you have. So the technologies are there; it's ready. The one fact is that you need to make sure that, again, as I said, that the products and services that you use actually implement the standards that you are trying to produce that you are trying to implement in Jordan, that the products and services abide by the same standards that you are trying to implement in Jordan, and so that everything is connected, whether it's products or services or hospitals across the country.
Well, thank you for your time, our panelists. In conclusion, I hope in this session we had shed light on the importance of e-health solutions for hospitals, for healthcare providers, but also for the patient. As we want to put the humanity value, not just the ROI. And I just want to say in defense of doctors and adopting technology, probably Dr. Faraj would agree with me, that doctors by training, we are used to one-on-one contact. So we are not, we hate technology or resistant to adapting technology, but implementing a computer or entering data takes away from that element, and we're resistant to it. But I think we are very fast in adopting technology when you force it on us, definitely. So I appreciate your time, and I encourage you to network and interact with our guest speakers. Thank you very much for your time.
Thank you so much.